Digital exclusion is a growing issue affecting millions. As more services like healthcare go online, many are left behind. Around 7% of UK households still lack internet access, and financial constraints or low digital skills make technology harder for many. Others face barriers like disability or poor broadband. Digital exclusion is not fixed, it can change over time. A person may be included today, but losing a job or developing a disability could make them excluded tomorrow. We all face different levels of digital exclusion, and even new technologies can leave some behind. Digital exclusion is complex because there are many factors at play. These include socioeconomic issues like low income, demographics such as age or disability, and infrastructure problems like poor internet access. Education, cultural beliefs, and trust in technology also make a difference. On top of that, there are many resources available to help: community hubs, support for Wi-Fi access, and even signposting services. But the issue is, information about these resources is scattered across many different organizations, and it's often hard to know where to go. So, people don't always have the guidance they need to get the help they deserve. This complexity makes digital exclusion difficult to address. To help tackle this challenge, we created the Digital Exclusion Heatmap. This tool helps us understand where digital exclusion is most severe by looking at the risk factors like poverty, rurality, age, or poor broadband, alongside resources available to support people like digital hubs, community or healthcare services. The heat map gives us a visual tool to see and compare these factors. It helps us explore and identify areas with high risk of digital exclusion and shows where community resources could make a difference. The heat map gives a quantitative baseline to help us make smarter decisions on where to take action. It combines different layers of information to give us a broader view of digital exclusion. The capacity layer shows where help is available, such as digital inclusion hubs or community services. The risk layer shows where people are most at risk, like areas with high poverty or poor broadband. When you combine these layers, you can understand better where the gaps are and where resources are most needed. It's a tool for understanding the complexity of digital exclusion and guiding our actions. The heat map calculates digital exclusion using a simple formula: risk minus capacity. Risk factors, such as poverty and poor broadband access, are weighed against capacity resources like digital hubs and community services. This creates the Digital Exclusion Index, ranking smaller geographical areas from 1, representing the most excluded, to 10, the least excluded. While not a definitive measurement tool, the heat map provides a baseline to visualize and compare the complexities of digital exclusion, using clear color coding to highlight key demographic, socio-economic, and infrastructure factors. This tool aims to support NHS efforts in reducing health inequalities by addressing 5 key domains: access to devices and data, identifying areas with limited access to digital hubs and internet, guiding resource allocation, accessibility and usability, pinpointing high-risk communities to plan non-digital support, such as printed materials, skills and capability, showing where digital skills training is needed to improve engagement with digital services like the NHS app, beliefs and trust, providing transparent data that builds trust in digital healthcare by showing available support. Leadership and partnerships, strengthening collaboration across regions to tackle digital exclusion and reduce health inequalities. While the heat map is a valuable tool for understanding digital exclusion, it's just the beginning. Tackling digital exclusion will take continued effort and collaboration. By working together, we can ensure everyone benefits from digital healthcare and no one is left behind.